Looking to save money on health insurance? Well, beware of health sharing ministries. And that's the topic of today's video. Now, I promise we're going to get to the topic at hand in just a minute, but before we do, please make sure to subscribe to stay up to date. And of course, if you find any value in this video whatsoever, please go ahead and click that like button so that we can get this information out there. Now, we are licensed health insurance brokers, so if you have questions about your health insurance, you can reach us in the comments below, but you can also give us a call at the number on the screen. There is absolutely no charge for our services, and we are licensed nationwide. So today we're going to be talking about health sharing ministries or health sharing plans. Now, if you have a health sharing plan and it's working great for you, then that's wonderful. But we do need to inform our viewers and subscribers about some of the downsides of health sharing ministries before they get in over their heads. That being said, we're always happy to hear from you. So please, if you have a health sharing plan and you love it, or if you have a health sharing plan and it didn't work out for you, let us know in the comments below. So what are health sharing ministries, also known as health sharing plans? Well, they're a type of health coverage, but they are absolutely not insurance. Generally speaking, members will have something in common, usually a religious belief, and they make a commitment in the form of a contract to contribute towards each other's healthcare expenses in the hopes that should they need reimbursement or assistance with a healthcare expense, they will be reimbursed or at least partially reimbursed. However, that is often not the case. Now, of course, the health insurance system is far from perfect, but health sharing ministries really are largely unregulated, and as a result, we've heard many horror stories about the corruption. So even though you contribute monthly to your health sharing ministry or health sharing plan, they are not insurance, and that monthly contribution is not the same as a monthly premium. A monthly premium is for an insurance plan. So with an insurance plan, you have some type of monthly premium to keep your insurance active. You may have a deductible to meet. Then once you've met that deductible, or sometimes very often prior to for preventative services, you'll have co-pays or co-insurance for specific services that are covered by your plan in your explanation of benefits. And of course, some of these services may be at a lower rate if they're in-network and at a higher rate if they're out-of-network. You'll also have an out-of-pocket maximum that's there to protect you from large medical bills. In a health sharing ministry, a group of people will pool their money together to help to cover the expenses should a member be in need. Then if you are in need of having your medical expenses reimbursed or partially reimbursed based on the terms of your plan, you may be. Now, because these are not health insurance plans, should you encounter issues with your health sharing ministry plan, well, you may not have legal recourse. The first major issue that I want to talk about is eligibility. So under the ACA, which is the Affordable Care Act, those type of marketplace plans cannot charge you more or deny you based on a pre-existing condition. And the same is true of group health insurance plans for the most part, 99% of the time, except for those plans that were grandfathered in, but really those are few and far between. Now, this is not the same with health sharing ministries. Someone with diabetes could be charged more. A child with cancer could be denied outright. Additionally, eligibility can be affected by your personal religious beliefs. If you don't subscribe to the religious beliefs or lifestyle as outlined in the morality clause of your plan's terms, then you could be denied. Now let's talk about issues with coverage. So as I just mentioned, you can be charged more or denied based on a pre-existing condition, or even if you gain weight, you could all of a sudden be charged more. And of course, that's not the case with insurance plans. But there are other issues other than just being denied or charged more. For example, there's no such thing as the 10 essential benefits. There's no guarantee that your benefits will really be covered, especially if that specific benefit doesn't subscribe to the morality clause. For example, very often something like substance abuse would not be covered because it violates that morality clause. And it can go even further than that. There was even a reported story where a woman was denied reimbursement for a broken limb. Now, how does that violate a morality clause? Well, it happened in a bar. Now let me stop here. Yes, I realize that we are painting these health sharing ministries in a rather negative light. However, there are a lot of people on YouTube who proclaim them as the alternative to health insurance to save you money. And while you may be able to save money, it's really important that you enter into such an agreement with your eyes completely open. And in all honesty, you may find absolutely no issue with the terms of your morality clause, which is fine. But because these terms are not clearly defined in the contract, you may find yourself denied anyway, and there really shouldn't be any room for ambiguity when it comes to financial reimbursement. Speaking of finances, let's talk about another major issue, which is, of course, the finances of these types of plans. First, as I mentioned earlier, regular insurance will have some type of out-of-pocket maximum. Basically, should you have major medical needs in a given year and those bills begin to stack up as you approach your out-of-pocket maximum, once you hit that out-of-pocket maximum, your insurance will take on the remainder of the bills for any in-network and covered services. This is basically there to protect you from major medical bills. Now, this is absolutely not the case with health sharing ministries. Not only is there no out-of-pocket maximum, actually it's just the opposite. Usually there's some type of financial cap on a yearly basis. So once you hit that financial cap, as opposed to the health sharing ministry taking on the remainder of the bills, you're actually cut off from reimbursement entirely. So that means you're on the hook for everything else. And there's another issue with how payments are issued. One, you may be denied based on any of the reasons we've discussed so far. Two, you have to pay upfront, which could be a financial hardship. Or three, if you're unable to pay upfront, well then your bill could go to collections while you're waiting to be reimbursed, and that could be unpleasant for a variety of reasons. Finally, ACA plans have the 80-20 rule, which is that 80% of your monthly premiums must go to covering your healthcare costs. 20% can go to other administrative costs. That's not the case with health sharing ministries. Because they aren't regulated, who knows how much of your money is actually going towards reimbursing the individuals versus administrative and marketing fees. So please don't be lured in by the promise that this is a less expensive approach to healthcare. Now, could it be? Yes, and if that's your experience, we'd certainly love to hear from you below. But it can certainly not be as well, and we've heard a lot of horror stories. So please, as I said earlier, just enter into such an agreement with your eyes open. There are alternatives out there like ACA plans. With the new premium tax credits, many people are eligible for lower cost plans than ever before. There's catastrophic coverage plans available through the marketplace if you are younger and in fairly good health. There's also short-term medical plans. Now, they're not offered in all states, but they are a much less expensive approach to private insurance. So please just look into all of your options, do your research. If you have questions, you can reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. There's absolutely no charge for our services, and we are more than happy to help point you in the right direction. But before you go, make sure to subscribe to stay up to date. And of course, please like this video so that we can get this information out there. If you have any comments or thoughts, we would love to hear from you in the comments below. As always, have a wonderful day and thank you for watching. Bye-bye.